Hello there, my name is Lauren Werscher. I am a graphic design and Spanish language double major here at MSUM, and I'm here today with Dr. Jessica Brown of the Community Outreach Center. Thank you for joining me today.
Yes, thank you for having me.
So could you describe the building that we're in right now, the COC?
Yes, so we're currently in Lohman Hall, which houses the Counseling Masters Program, the MSUM Counseling Masters Program. And part of our Masters Program is we run an on-site clinic that provides free services to the community and surrounding areas, to our students. And then in turn, the counselors that staff our clinic are practicum students, so they're able to count their counseling hours towards their clinical mental health practicum.
Nice. So as a free on-site mental health clinic, if you raise funds, what do they go towards?
A variety of things. We could do so much with the funds. So like I said, we're a student-run clinic, and so because of that, we have certain requirements for accreditation and best practices. And so some of the funds would go towards technology. So for example, we're in a clinic room right now, and each clinic room is equipped with a camera, and then we have an audio visual room where that records each session, where we can provide supervision, live supervision and observation and feedback to students. And so being able to increase our the technology would just be great, would really add to that. Yeah. And then we also envision it would be great to provide transportation, bus tokens to clients to try to address barriers in accessing treatment. So that's one kind of dream that we have that we could do with it. Additional training for students, additional targeted training. So a lot of the needs we're seeing: increased suicidal ideation, increased rates of depression and anxiety, increased rates of self-harm, doing targeted trainings that if we had funds to pay for, wouldn't be at the cost of the student.
Very nice. So you mentioned having this clinic be accessible for everybody, like the community, students, everyone like that. So who do you think are the greatest users of the Community Outreach Center? Is it a mix of the community and the students, or is it like one or the other?
So I would say our services are intended for anyone and everyone. So we get a lot of folks from the community, children, adolescents, adults, referrals from other agencies right now. There's such a high need for mental health services that it's a couple month wait sometimes to get into places, and we can usually help to address that need. So we get a lot of referrals from agencies. We also, because of COVID, have started offering telehealth services, and we've continued to offer telehealth services. And so there were high mental health needs in students in schools, especially in rural areas that lack access to mental health services. And so we've been providing telehealth services to schools, to students in need of services across Minnesota and North Dakota. And so, but we also see a lot of MSUM students. For example, if the MSUM Counseling Center on campus is full, they refer clients to us, and clients to us, so we can help them address the overage and provide needed services.
So to you, why is it important for people to give today on MSUM Giving Day?
So I really believe that right now we're in the midst of a mental health crisis, and it's just really important that we help to meet the need. Like I said, there's increased need. We're seeing spikes in suicidal ideation, self-harm, high rates of anxiety, depression, and so being able to provide services to folks who need it is absolutely crucial.
Very nice. Well, thank you, Jessica, for joining me today. This was a very fun interview, so thank you for joining me. And thank you for watching online. Make sure to visit mnstate.edu/givingday to help causes just like this.